your smiling face, I have to smile myself.
Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. You can reach me in my office at 631-261-4525. We have an exciting guest today, and I want to introduce her, but first I want you to hear a very familiar sound to you. So I want to know if this sound is familiar and scary and keeps you away from the dentist. If that's the case, you need to come see us. We're in Huntington, and our website is drames.com, and my guest today is naturesdental.net. So, okay, enough of that. I want you to know that we use air abrasion. It's gentle. It sounds like a water spray. It's so soft that I couldn't even record it to play it for you. So know that if that's what's keeping you away from the dentist, you have wonderful, gentle dentists that we are actually both afraid of the dentist. So we're going to treat you in the best way we can. So I want to introduce my colleague, Dr. Olga Isaeva. And we met through biomimetic dentistry. The mission of the show is to tell you, to get the word out about biomimetic dentistry, because it's a big paradigm shift in dentistry today. Dentistry of the 20th century failed us. It leads to crowns and root canals and implants, extractions. And we are saving teeth and avoiding root canals. Dr. Olga will tell you about one of her patients today. But first, let me ask her. Welcome, Dr. Olga.
Oh, thank you, Margaret. I'm glad to be here.
Thank you. So we are so compatible in the office. It's such a pleasure to work together.
Right.
I just want you to tell the audience why biomimetic dentistry is so important to you. Tell us how you came across biomimetic dentistry.
Wow, well, that's a good story. It could make a long story, but I'll try to be brief. So it's very personal to me because, I consider myself a holistic dentist, as you know, and back like 7 years ago, I wanted to replace all my metal fillings, and I see a lot of patients that seek similar treatment. So the treatment of choice for replacing big metal fillings is usually crowns, and it was literally killing me to remove so much unnecessary tooth structure, and which very often may lead to root canals. And
that wasn't for you. That wasn't.
No, that wasn't for me. It was something that I experienced myself as my fillings being replaced. I ended up with 3 root canals and the crown, and I was very disappointed. I know the dentists did the best they could, but that's a traditional dentistry, and what we're talking about today is an alternative, I would say even holistic approach, and that's biomimetic dentistry. And in search of a better dentistry, I came across this particular term on the internet. And as I read the definition, it made perfect sense. I said, this is exactly what I've been looking for. I just had no idea how to do it, but the definition and the minimally invasive way just really resonated with me, and within a day I was able to locate the center that trains dentists. And just recently you had Dr. David Alleman on your show, who is one of the founders of the Center for Biomimetic Dentistry. So I got the training within a couple of weeks, and that changed my whole practice, and I'm so happy now. I'm not disappointed in my dentistry, and this is a great way forward.
It's so exciting. I thought when I took Dr. Alleman's course, and we'll put a plug in for Dr. Alleman because he is, for the 21st century, he is the guy that makes the difference. Like dental students learn about G.B. Black and his principles. Right. David Alleman is the one whose name will go down in history for his contribution to the dental health of so many people.
Oh, I'm sure. This is the future of dental care. Biomimetic dentistry is the future.
So you had some white fillings put in, but they weren't really put in biomimetically, were they?
Right. They were bulk fill, which is very similar to if you put a metal filling in the tooth, and the same way you put a white filling. And these are totally 2 different materials, and unfortunately it's not being taught as a different material, and many people end up with the same problems. It's sensitivity after white fillings been placed, or leaking white fillings, or micro cracks, and that leads to more aggressive dentistry like root canal or crown. And thanks to you, Dr. Ames, we're in the process of replacing some of these white fillings to biomimetic bonding. Yes.
It's pretty, treating another dentist is certainly...
Well, if I'm holding the mirror the whole time, I'm checking every step.
But really, it is a joy. I mean, when I took out one of your old white fillings, it just kind of fell out. It was like somebody plugged a pothole. And that seems to be the way it's taught. And unfortunately, our colleagues aren't running to grasp at the opportunity to prevent a root canal. Tell us about the patient that you saw today who was told she needed an extraction.
Oh, yes. That's a great story. Every day we see that, but just today, the patient comes in with 2 teeth that were recommended by a dentist to be extracted.
I'm going to interrupt you because this is exciting, but I want listeners to know, if you're just tuning in, you're listening to Your Dental Health. I'm Dr. Margaret Ames. My visitor today is Dr. Olga Isaeva, and we practice together in Huntington. The number is 631-261-4525. And she's telling us about an experience she had today with a patient who was told that she needed 2 teeth extracted. So go ahead, Olga.
Sure. Well, this is the patient that's already missing a lot of teeth. And because she couldn't afford the root canals, which could possibly be done and saved, the teeth could be saved with the root canals, she simply couldn't afford it. So she was looking for alternative treatments and thankfully found us, and we had the time to see her. And what a joy. She gets to keep her teeth. The treatment is much less than root canals and crowns. And priceless tooth structure that we save. You just can't put a price tag on that. And she was happy. We're happy. It literally makes our hearts sing when we can do that and save this precious natural tooth structure.
It's so funny because I overheard you, and it was just so much fun to, because we have the same joy in doing that. And then that other patient that came in this week that lives upstate and found us on the website.
Yes.
And that was quite exciting. How old was she?
She was 5 years old. And she was terrified. I think she had a couple of bad experiences. Nothing dramatic, but just being separated from her mom while the treatment and the sound of the drill that we all just heard. The minimal invasive way of biomimetic dentistry is air abrasion. And once you get that out and that sound of the air that we played earlier. Did we play that?
We didn't play the air
Okay,
version.
we're going to play
quiet.
that. We're going to play that. It's just such a difference that really put her at ease, and mom was able to stay with her in the room. I have no problem with that. If a child feels more comfortable, you were able to treat the cavities without doing the baby root canal. And she was told
that she needed
she was told she needed a baby root canal and the stainless steel crown, which in the process of a crown, just like in adult teeth, there's so much natural tooth structure needs to be removed just to place that crown that surrounds the whole tooth. And if you imagine that, well, you like to call it amputational dentistry, and it's such a fit term for that. Her mom didn't want to do that, and I said, well, that's not something we do at all. So I'm just happy you're here. And we're able to save it with the regular bonding, biomimetic bonding, and hopefully that's going to last her another couple years till she loses that baby tooth.
Yeah, the quietness and your gentle manner really turned her around. That amputational dentistry, that baby tooth root canal, stainless steel crowns, it's so 20th century. I mean, really, come on, let's get with it.
Yeah,
Ladies and gentlemen. Biomedic is the way.
Yay.
So, it was a very exciting week working together. My patient Cindy came in. She scheduled the whole day. She just got it, that she knows that biomedic is the way. She had gotten 3 crowns herself, and 2 of them have root canals. And she said, I never want this to happen to me again. Well, what a great patient, I have to say, because I told her I would talk to her about her on the radio. And she's the best patient, just appreciates... was able to tolerate long treatment because we're gentle. We gave her the tooth pillow. We put a tooth raincoat on so she wouldn't get any of the water in her mouth. She had a bolster behind her knees so she could relax.
Sounds like a spa.
It does feel like a spa, doesn't it? So tell us, you went to, where did you go to dental school?
I went to LSU Dental School in New Orleans.
And graduated 10 years ago?
Yep, 2004. And has been practicing ever since. I've been to North Carolina. I've been to New York now for 7 years. So thankfully found biomedic dentistry.
Well, after the break, we'll talk about the process that you went through in your practice.
All right.
So please stay tuned. Dr. Olga Isaeva and Dr. Margaret Ames. Dr. Olga is at naturesdental.net, and I'm at drames.com. Please call our office at 631-261-4525. Stay tuned. Email us. Let us know what you want to hear about, the procedures that you'd like to hear about, and come and see us. See you after the break.
Oh, how much longer? I thought I was in love a couple of times before with the girl next door, but that was long before.